Ladies and gentlemen, this is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports. Here's your host, Shaun Keating.
Hey everyone, Shaun here. Welcome to another episode of the Dental Up Podcast. Our guest this week graduated from Southern Illinois School of Dental Medicine in 1996. While attending dental school, he co-created a successful novelty product called Billy Bob Teeth, which has brought joy and laughter to customers worldwide for over 20 years. He is now the director of on-site dental services, bringing high-quality dental services to senior citizens and long-term care facilities. Currently practicing from Sloatsburg, New York, please welcome Dr. Rich Bailey Dmd. How's it going, Dr. Bailey?
Hey, Shaun, how you doing? Good to hear you.
Dude, thank you so much for coming on, man. Dang, when I seen you were the dude that's coming on the podcast today, I'm like, I know that guy. I remember way back, and I swear we had the old lab I worked at. We just marveled at those Billy Bob teeth, and we made our own. And
Awesome.
they're big sellers there for a while, but they're quite a bit more expensive. I think yours were going for about $20 a set or so in the stores back in the day, or I think it was around $20.
Yeah, that was kind of probably our main price point. We of course offered fries with the shake. So if you wanted your tooth chipped, or you wanted an abscess or
Yeah.
a cavity, we charged a little more for that. But yeah, that was kind of the regular retail price, $20.
Unbelievable. And yeah, they had like the pus ones. They had some funky looking ones, and I think the hillbilly ones were like the best. Right about that time too, we had just did the gold member dude, Austin Powers. We did his teeth for the movie, and had to do like 20 sets, but very similar to your Billy Bob teeth. They're a European type, London brown teeth with stains, and it was kind of a neat thing back then. But I remember doing them too around Halloween. It was always really a dentist would always say, Shaun, could you do me some vampire teeth? And so we always did the vampire teeth. And I just right here, I got some that I did I put all these diamonds on, they're just like porcelain teeth, but we did them kind of like my temporaries that I make. And so we kind of get the little tight fit in proximal spaces and all that. And it kind of like a Flexite type partial thing, but it's a facial fitting restoration. But I got these ones with big old carat diamonds in them and small. I just got it 6 through 11, but I put them on all the time. They fit like a glove, and I haven't made me
lower the property value wherever you go.
Exactly. Oh man, because you could do that, dude. I mean, you put in a bad set of teeth like these, man, and you look at somebody, and it just, it really does make a difference with teeth, man, because they would think, you got a good grill and all that is one thing, but if you come in with those teeth, and it's just like, I got a picture of you on your site and stuff. It kind of shows you with the Billy Bob teeth, and you got the perfect picture of you above with your suit on. You look like a Hollywood movie star. Then you got your thing down below with your picture, and it's like, well, where'd Billy Bob come from? Dude, that's pretty.
Yeah, you figure out pretty quick who loves you when you're wearing the teeth.
Oh, yeah, exactly. You find out who your real friends are, man. That's why, you always say you can be fat, you can have a big, ogre, whatever it's called, on your face, or it really doesn't matter. But, with a lot of people, that's the way people are. But when you really have a bad set of teeth, it's just so... People always put their mouth, hand over their mouth, or they just don't have the self-confidence, where you can have confidence just in the way you look for sure. But when your teeth are all missing or crooked and this and that, I think it's really hard for people to have a, true confidence and stuff. And that's why I just love that we can change a person for sure. With teeth make a difference. Like,
teeth make a difference.
Yeah. Like me, I'm kind of a fat slob, but I got a great set of teeth. So people look at me like, hey, Shaun. No, I'm just kidding. We better cut that out there now. Well, dude, I always start off a little bit talking about sports. Now, are you into any of those Yankees out there that you're out in the, how far is Sloatsburg out of New York City? It's pretty far.
We're about an hour outside the city.
Okay.
Actually, the team that I love is the team that everybody hates. I'm kind of a fan of Bill Belichick and the Patriots.
Yeah, that's awesome, dude. That's hard. I've never heard many New Yorkers that are big Boston guys, but now Belichick's a freaking legend, and what they've done is unheard of. And even too, Tom Brady, that dude's 42 years old, man. He's up there, and he's slinging.
Pretty amazing.
Yeah, and then you got Andrew Luck. He just retired over the weekend. 29 years old, and only been in the league like seven years, and had a few good years. I mean, he made Pro Bowl like 4 years, and he just had a rash of injuries the last several years. That's 2 or 3 years, and he just all of a sudden just said, you know what, I'm out, man. And that the owner, Israel or whatever his name is, that owns the Colts. He was saying that he probably left close to $500 million on, the plate. I mean, he could have got a couple 3 or 4 year more contracts, and these contracts are coming out for $250,000 for a lot of these quarterbacks, the elite quarterbacks. They're getting paid so high. I mean, kind of like these baseball players, and all that. They got these $300 to $400 million contracts. I don't know how they got it with a game like baseball. It's so boring to watch lately. It's like, I couldn't believe it.
Yeah.
But he it goes to show you, man, that they're just humans like all of us. And at the end of the day, you want to be able to pick your kid up in the morning, and you want to be able to walk like your knees and everything else. I mean, football really does ravage your body. And I played 8 years of football, and that was 4 years of youth and then 4 years in high school. And I'm feeling it, man. I just had a birthday last week, man, the big 5'7", and I feel like a 77-year-old. It's like that'll beat you up. I was a running back, and I went head on, and I probably had 30 or 40 concussions, man, through all my years, and, seeing stars, because that's what we were taught, go head on and, freaking hard as you can, hit those guys, try to flat back them, and, it's the only...
Name ramage.
Exactly. It's the only sport where your kids can go play, and their parents are clapping after little Johnny just went and knocked the other kid on his block, on his back, and, took him out of the game, and all the parents are clapping. It's kind of crazy that, this day, I guess they do that in hockey kind of, but football's it's a different beast, but a lot of stuff's coming out now with all the CTE and all this stuff in the head and brain and the whole thing. Like Antonio Brown with his helmet with the Raiders, like he wants to play with his helmet that he's had for 10 years. And it's like, no, those aren't certified anymore. And the technology now is they're able to protect the noggin quite a bit more with the newer helmets out. So with the newer technology, and I'm all for that. It's like, it's kind of it's a really ruthless sport, and you really don't realize it till you get older and you see,
It's pretty rough.
Yeah, it's pretty rough, man. And if I had a little kids, not like as soon as my kids were old enough, I had 2 boys, as soon as they're old enough to, play football, I was coaching them and had them in there, and they're both kind of banged up with knees and shoulder issues, and they're in their early 30s, and it's just like, yeah, I'd probably rethink that if I was a parent coming in, and maybe not let them do youth football, maybe high school, but even at that, at the end of the day, man, you got to look at the pros and cons, and I just think there's too much to lose with it, with all the different things that they're finding later. I mean, I don't know. It's just you think of all that glory.
I think dentistry is a better way to earn a living.
Yeah, absolutely. No, I hear you there, man. Well, dude, let's go ahead and dental up. So tell me, Dr. Bailey, now, why did you get into dentistry, and at what point did you think, I want to be a dentist?
I probably started thinking about it in high school. I think the thing that appealed to me was the way I viewed it at the time is it's a combination of hand skills and people skills. And both things kind of appealed to me. I can't deny that there was that there was a money motivator too. My dentist had this sweet car, and I thought, well, that could be me. And so there was that part of it too. But I don't think I really knew well, most of us don't know what we're getting into until we're into it. But I thought everybody was going to love me. I didn't understand that we're not the most popular people in the world. But luckily, there's enough things about the job that do appeal to me that I feel like it is a good fit. But yeah, those two things really probably motivated me as much as anything.
No kidding. I like that. Had a hot car. A lot of dentists got some nice cars, and some of them don't. But yeah, I always heard that from a lot of guys. Like, well, the dentist drove a nice car and he only worked a couple days a week, and I thought it was a nice kind of job to have, and it's so true.
Yeah.
But then you got doctors that worked 6 days a week. You got your worker bees and non-worker bees in all fields, I think. But I think there is a lot of successful dentists that do a shorter 3-4 day week and are very successful. And it's pretty amazing. Not many industries you can do that, and
yeah, we're really fortunate. And, I think as you age, your motivators change, what drives you, what's important to you. So that's what I was thinking about at the age of 16, but how many 16-year-olds have any real deep, quality thoughts. So
exactly.
What motivated me then is not really what motivates me now.
No, I hear that. And yeah, wait till you turn, you're not 50 yet, and it'll come someday. But once I got over 50, it really, you start thinking about things a little differently and about life in general, man. It's like, dang, I made it to 50. Am I going to make it to 56 or 50, 60? It's a trip how, you look at life a little different as you get older and wiser, man. It's I think you become more thankful too as you see your kids grow and all that. And it's just a blessing what we're going through. And every day is a gift, that's for sure. But well, dude, tell me a little bit at where you attended dental school. Tell me a little bit about that. Tell me some of the things you liked, some of the things you didn't like.
Yeah, it was Southern Illinois School of Dental Medicine. I think in retrospect it was really a good program. One thing I appreciate about it now that I probably didn't appreciate then is at the time I went through, it didn't have any specialty programs. I think a lot of dental schools out there, if a tougher case comes along, those tougher cases get skirted to the specialty programs, and the regular dental students don't get to treat them. Where at my school at the time there were no specialties, so it was boot camp, and I can't say that it was always fun, but I feel like we were pretty as prepared as you can be, for that stage of your career. It's like anything. You grow, and I think there's a pretty high attrition rate at my school. The standards are pretty high, and you had to be self-motivated to make it happen. In retrospect, I think it was a good education, though.
I love Chicago, man. How close was that to like downtown Chicago? Pretty far or close?
Well, pretty far, actually. We were actually Southern Illinois, is in Alton, Illinois. So we were a suburb of, more or less of St. Louis, Missouri.
Oh, okay.
So we were a little farther away from Chicago, probably 4 or 5 hour drive.
Okay, cool. Tell me a little bit down. Did you start out as an associate right out of school, or did you buy a practice? Tell me a little bit about your startup as a dentist when you got out of college.
Well, the first year and a half approximately out of dental school, I didn't practice any dentistry. You mentioned the story of the Billy Bob teeth. So I had this little invention, and it was fun. And I had a buddy of mine, his name was Jonah White, that was helping me get it started. And we just had a blast selling teeth. So in the beginning, I knew that an opportunity like that wouldn't come around twice. And, I wanted to take advantage of it. So, we started off at little things like county fairs and, state fairs and, gun shows and car shows. And, from there we went to NASCAR and state fairs and coon dog conventions. And I mean, you name it, NASCAR, Super Bowl. I've been to all 50 states, and I've met all kinds of weird, interesting people, and I got stone crooked, ugly teeth. So I don't regret it, but after a while, I could see that it's not what I wanted to do with the rest of my life. And I wanted to, that old saying, if you don't use it, you lose it. So I was concerned about forgetting what I learned in dental school. So I decided to get back into it, and had some family that lived in Idaho. And as I said, I'd done a lot of traveling. And so that neck of the woods, western Montana, northern Idaho, eastern Washington, to me, it's some of the best, part of our country. And so I just decided I was going to job hunt out there. I didn't have anything really tying me down at the time, so I looked for job opportunities there, and I ended up buying a practice that nobody had been in. The equipment was still there, and it was this little blue-collar town in North Idaho. Okay. Potlatch was the name of the town, and I practiced there for 10 years. It was a great experience in a lot of ways. It was, it's 45-minute drive, maybe 50-minute drive in any direction to get to the next closest dentist. So, I was a one-man band, I guess, for a while, and I enjoyed it. But after a while, I felt like it was time to make a change. I think a lot of us don't understand what day-to-day dentistry is going to be like. Even dental school, you don't get the perspective, and although there was parts of it that I really did enjoy, as I said, the people skills part, the hand skills part, that part I enjoyed. But what was wearing me down was I didn't understand going through school that dentistry, running a practice is really multitasking.
Yes.
You can call it a lot of things, but, you're working on one person. You got the hygienist giving you the dirty look, because you need to do the exam. You got somebody else coming in 15 minutes. There might be a little drama going on with your staff that day. There's just 3 or 4 things going on in your head all the time. And at the end of the day, that pace, it's a money-making machine. There's no doubt about it. But that pace did not fit me. It did not suit me well. And I think most of us are not good at multitasking. No. Women are, but after a while, it started bugging me, and I didn't know what to do or how to change it or, what my options were. But I knew that to some extent, I felt like I was Bill Murray in Groundhog's Day. I was just living the same day over and over and over and having the same conversations with the same people. And it kind of lost its luster. Yeah. So I knew I had to make a change of some kind.
No kidding. So you got out of Idaho, and then what?
Well, I stayed there for a while, and took some time off, and did a little soul searching. And I didn't want to give up dentistry, but I didn't want to keep practicing the way that I had been. Okay. And so I started, trying, filling in at different dental offices. There's always a need for, fill-in dentists. And I just wanted to see what else was out there. And I probably filled in at 7 or 8 facilities, and I enjoyed it to some extent. But finally, I found a place that was going to be okay. I was just, working for a friend of mine as an independent contractor. I did that for like 7 years, just 3 days a week. And I was able to just go in, do the work, leave, not have to worry about any of the business side of it, the practice management side of it. That part of it was good, but still to some extent, I'm multitasking. And I just didn't know how to re-engineer dentistry to make it work better for my personality. And I started recognizing the problem that seniors go through. These senior citizens would come into the practice, and most of them had taken really good care of their teeth their whole lives. Yeah. And then all of a sudden, they come in for one checkup, and there's a dozen cavities, and they're at the CEJ, and they're deep, and how did this happen? And so I saw the need that I think a lot of us do in private practice. And I called the administrators and asked them, could you help them with with their daily oral hygiene? And it always seemed like that plea fell on deaf ears. Okay. So I started thinking about mobile dentistry, and I started taking a couple classes on it. I could quickly see why there aren't many dentists that go into it. One problem was the equipment was really clumsy. I'd seen what was out there, and it, a lot of guys are doing dentistry in RVs.
Yeah.
And I can't think of a better way to upset a frail old lady in February, pull them out in the parking lot, so that part I could see was not well thought out or designed. And then some guys were doing dentistry literally while the patient is sitting in a wheelchair at ground level, so you're hunched over like a shrimp. I mean, how long can you do that before it, destroys your spine? So that part of it I could see was a problem, and also the workflow. Nobody had devised a way to earn a living at doing this. The need was there, but those two things were a problem. And so I just started trying things and brainstorming. And, I've always believed that, you can learn something from anybody. So I always was bouncing ideas off different people, sometimes dentists, sometimes people that were not in the dental industry, just trying to brainstorm to how to make it more efficient, how to make it work better. And after, a period of a few years of, bloodying my head against the brick wall, I finally figured out the equipment that would make it efficient and easy. And I figured out the workflow of how to design the day so that you're not wasting time, that you're earning a good living at it. And then the best thing about it to me was that the idea that I could tear up the schedule, because, senior citizens in nursing homes, they're not going anywhere. Yeah. They're there. So the whole place is kind of like your waiting room. And why have a schedule? When you tell a senior citizen of that generation, you have an appointment tomorrow at 9 a.m., they just stress out and they show up too early and they pace. Or if you just show up on short notice and say, hey, I talked to your daughter, Debbie, and she was real excited about us getting your teeth, checked out today. So we're just going to have you hop in the chair. That worked way better. And the person that's in my chair has my undivided attention. There's nobody else waiting on me. It takes what it takes. So, that pace of dentistry just suits me so well. And I do not feel exhausted at the end of the day. I earn a really good living doing it. Old people are quirky, they're funny, they're weird. And I dig that, and you get to have the time to interact with them, to get to know them. And that part of it really appeals to me. So, I don't feel like I'm a dog chasing my tail anymore.
No, I mean, it's very unique. And, I was reading about you on this Dental Town a few months back, and you're on the front cover, and it's just a really great thing, your story. And now, it's geriatric dentistry and it's mobile dentistry. And you're just talking about how it's tough on some of these pages, the plaque buildup, not being able to, go see the dentist. And what you're doing is like a hero. I mean, I think it's neat. There's not a lot of dentists that are raving and wanting to go work in older patients, in the old folks home or wherever it's at. That's just awesome, dude. Hats off to you, man. No, that's really neat that you're doing that. And
it's not sexy, cool dentistry for sure. If a person's goal is to expand their skill set and to, try every high-end thing that's out there, this is probably not the job for them. But if they want to help people where there's really a need and they're willing to do what I call blue-collar dentistry, drilling and filling, that kind of thing, then there's an incredible need for it. They call, this group, baby boomers that are coming into the senior citizen stage now, they call it the silver tsunami. I mean, there's so many people.
They're coming in now.
They're coming in.
I'm the last of the boomers, the youngest. Me and my wife are like 64, and she's born in 64. I'm 62. I think it goes to 1960. Or no, I think 65 is the last, and then before, or whatever. But we're all, someone's going to have to be wiping my bum in a very few years, and I'm getting set up. I'm saving all my money so I can have it all picked out and, person that's going to be there, because I know when you have two boys, when you have daughters, your daughters will always take care of you. But you have sons, they ain't going to take care of you. They're going to pass it off onto someone. So that's why we got our marbles in our head. We better take care of that now. But no, that's what you're doing is just freaking awesome, dude. I just think, How is it? So when you go in, I mean, how do you have a portable chair? Do you have a portable handpiece? Tell me how you're doing it, and tell me a little bit about, I mean, what are you doing? Are you doing like extractions? Are you doing any fixed work, or is it mostly like drilling and filling? And tell me a little bit about your setup and how you did it and what kind of procedures you're doing mostly.
Okay. Well, before I tell you about the procedures, I kind of have to share my philosophy a little bit because, with seniors, maybe the only blessing that comes with aging is teeth lose a lot of their vitality. So, you can do restorative teeth, or you can do restorative work on senior citizens' teeth quite often without getting them numb. And that's a real advantage. So that lowers drama a lot.
That is really awesome.
And also when you look at some of the mouths, because a lot of the mouths are, I call them train wrecks. They're at the train wreck stage. Things don't look very good. Okay. The average person who's not in dentistry would think, this person really should be in pain, but they're not. So they're not in pain. There's not a lot of vitality. So you don't actually get a lot of like raging acute cellulitis infections. What you have is a lot of teeth that are not restorable.
Okay.
But on the other hand, I try to remember this, that at the end of the day, your goal, my overall goal with trying to help these seniors is to make them happy. Absolutely. And if they were in their 30s or 40s, then of course we'd be extracting teeth and, placing implants and making, fixed bridges or dentures, whatever they want. Mm-hmm. But at this stage, when you get that creative with your treatment planning, all you're going to do is upset them.
Yeah, exactly.
And although their circumstances are far from perfect, human beings have this amazing ability to adapt to the circumstances the way that they are. And, even though a lot of their teeth are broken down, they know how to get their food down. So I over time, slowly developed a philosophy where I told them, look, on one hand, you would be healthier without these teeth. Your immune system would not be in battle mode. But on the other hand, these extractions, they're not going to be that fun. You're 90-something years old, and even if the tooth comes out nice and easy, you may look like you're in a bar fight the next day.
Exactly.
And there can be bruising and swelling, and you got to be mentally prepared for that. So if you want me to take them out, I'm at your service. But on the other hand, if you don't want to do it, another option would be to have me smooth off all rough edges. I can excavate some of the tooth decay. I can paint in a product that's designed to slow down tooth decay. You're still, even though these teeth are kind of broken down, you are actually functioning on them.
Okay.
So at the end of the day, that ends up what happens a lot with the non-restorable teeth is smooth off rough edges, and we paint in silver diamine fluoride, slow down the decay. And then on the teeth that we can restore, I call it drilling, filling, and billing. We excavate tooth decay. Usually we're able to do it without anesthetic. We're packing in, the filling material that you like, the bonding system that you prefer, whatever. And then, and we don't try to fully restore the teeth. Most seniors cannot tolerate a crown preparation. It's just too much time in their mouth. But you provide a very valuable service in helping them keep what they currently have. So, and, with seniors, it's kind of like working on kids. Their attention span isn't very long. And, if you can keep them comfortable and distracted, you got a chance of getting something done. So we play their favorite music. As far as the equipment goes, one thing that really helped is when I upgraded to, I actually use an electric wheelchair as the dental chair. And the chair also serves as a taxi, because they might be down playing bingo or whatever, and so I drive it down the hall, and we get them put in the chair, and then we use a couple extra pillows to make this chair super comfy. I ask them what kind of music you like, so we're playing Lawrence Welk, Glenn Miller, whatever they want to listen to, and then we bring them down to the dental operatory where we're at. I have I invented this light stand which holds the dental light at the right height, because one of the challenges with seniors is when you tip them back in the chair too far, they have swallowing problems. And so we do stand-up dentistry. So that means that we don't tip them back as far. which means we got to have a lighting at the right height. And, I tried all the headlights that are out there and just found that I wanted a standard dental light, which provides, the best lighting. And so I invented this light stand, which holds a standard dental light at the right height. And then I have a delivery unit company that I use is ASI, and they're in Colorado, and they make an awesome product. I mean, there's some other good companies out there too, but I just think that the machine they make is the best. And when it's something you're using every day, you want it to be reliable. Yep. You want it to to be able to handle the pounding that moving in and out of buildings delivers. And the thing is pretty darn quiet for a mobile unit, and you can use conventional hand pieces on it. So anyhow, that's some of the equipment that I use to deliver the service.
Unbelievable. That's neat, man. That is just such a neat thing, dude. Just seeing that and going where no one else really went. And there's going to be so many baby boomers in the next 20 years, 10, 15, that are just going to be
a lot of them.
A lot of them, man. And it's a trip, but good for you. And just even too I'm just so impressed with you creating those Billy Bob. Over 15 million sets of those teeth have been sold. You made a little money on that, huh?
Yeah, for the time that I spent in it, we made a pretty good chunk of change. It was not the lifestyle for me, to run that kind of business. You got to be willing to stay in hotel rooms a lot, and that didn't appeal to me that much. So, I kind of like to be home at night. So, but there aren't many things in life that you can say that you got a lot out of that you didn't have to put a lot into. So that was one of those that was a lot of fun, and I don't regret doing it. It's just not what I want to do the rest of my life.
No, I hear you. And even too, just doing regular dentistry. I mean, I got a lot of dentists that are in small little towns out, in Alaska and different parts of the United States that, there's no one around for, 100 miles and you have to do a lot of your stuff. And I thank God that they got a post office that'll come and get them, and, I'm able to do their work. But what you're doing is just a unique niche, and maybe more dentists are doing it that I just don't realize, but you're kind of giving back.
That many.
You really are giving back and doing that, and the people gotta just love it. It's because you're a funny dude. I mean, I was talking to you for a while there, and you got that sense of humor, and I mean, even too with at such a young age to do something with the teeth like you did, and then to do regular dentistry like everyone does, but this to say in your heart you felt it's really not feeling it, and then to find this, I mean, it's a path, dude. And it's just something, just your whole setup, the way that light looks and what you develop there and your little taxi, wheelchair and how that works. It's very, very unique. And man, I could see that replicated across many states but you're going to need the right dentist that is going to have the heart and the patience to do that kind of It's not all about the money. It's about the people and helping them.
I think you're right.
Yeah.
I've gotten since I wrote that article, I've gotten a lot of phone calls from dentists, and it's kind of interesting. I think those of us in the dental field, a lot of us tend to be introverts. I'm not, I'm more extroverted, but I think everybody who's been in the dental field for very long feels the strain of multitasking.
Yes.
And, part of them wants to do it a different way. But it's kind of an all or nothing thing. If you're going to serve this group of people, you got to be willing to, get the right stuff. You got to get, trained on how to use it.
Yeah.
You got to know how to set up the accounts. I mean, there's nothing, there's no rocket science to it, but you got to be all in if it's going to work well. And I think sometimes dentists toy with these ideas. Oh, I'd love to have more freedom. I'd love to have more flexibility. I'd like to enjoy what I'm doing more, but I think a lot of people in our field have trouble pulling the trigger,
Yeah, absolutely.
I just kind of feel like life's pretty short, and, if you're not happy, you better get happy, because, you don't get second chances at, the time that we have. The time is our most valuable commodity that we have. So we better use it to the best of our ability.
Absolutely. Can't buy time, man. Can't buy it no matter how much money you got. I mean, look at that Koch dude that just died. He was only 69, I think, or 70. I think he was 69. $40 billion.
The billionaire?
Yeah, $40 billion in the bank, man. Nothing. What can you do with it? Nothing. I mean, it's just same thing with like jobs,
Yeah.
you know, you just think of all these people and God, you know, and I always have a saying that yesterday's history and tomorrow's a mystery, man. We got today and no one can dispute that. There's no one out there because it's just, you know, I won't go there. We'll just kind of keep rolling here. So tell me a little bit about are you doing any more CE that you have to keep up? Well, you have to keep up on it somewhat, but what are you doing for CE? Mostly online stuff? And are you going to any of the shows, Chicago Midwinter maybe? Or tell me a little bit about that. If you
There's two shows I've gone to recently. I went to the New York Greater Dental Meeting last fall.
Okay.
And then this spring I went to there's a group called the Special Care Dentistry Association. So anybody who's involved in geriatric dentistry or, you know, special needs dentistry, that's kind of the group. And so that's where you get a lot of classes that deal with how to help seniors, how to do mobile dentistry, that kind of thing. So
we'll put that on our show notes for sure, you know, because I'm sure there's some guys out there thinking, you know, listening to this podcast going, hey, it's an avenue I could do and kind of feel good about myself, you know, and, you know, about not worrying about some vain rich lady and getting a 4 to 12 or 4 to 13 done. And she's not happy with the color, where you can take care of people and feel appreciated and sometimes not feel appreciated because they can't let you know how they really feel. And I mean, what about with the special needs? Are you working with those too, or is it mostly geriatric patients or special needs patients?
I mostly focus on geriatric, but you could, I mean, you know, mobile equipment is mobile equipment. You could use it in any environment. You know, there's you know, sky's the limit as far as where you use it or how you use it. So yes, you could serve that group. You know, I work on friends and family at my house once in a while. Yep. You know, so-and-so needs a bridge, whatever. So, you know, I don't want those skills to get rusty, but it's not what I do full time. But, I think, you know, you can use this equipment any way that you want to, once you know how to use it. And, you know, the way that I provide care with this specific approach, this equipment that I use, it's not the only way to do it. You know, if you take the continuing ed, you're going to see how other dentists do it. I feel that my way is the simplest way and the easiest way, and the most efficient from a logistics and from from an economic standpoint. You know, my overhead for my practice is probably 15%, which is way low.
That's so awesome. Average GP is like 70, 80.
Yeah. Oh, it eats them alive. And, you know, another big advantage to this kind of practice is the flexibility, because, you know, seniors, they kind of forget you exist 5 minutes after you leave the room. So,
exactly. That's so true.
And my staff is all part-time. You know, it depends on how much I want to work. So, I mean, I have literally disappeared for 6 or 8 weeks taking trips with my family.
Beautiful.
And when I got home, nobody was mad at me.
Yeah, you gotta love that. I mean,
you can't do that with most businesses.
No, you can't. Do you still have a brick and mortar practice, or you just got it straight out of the house, huh?
I mean, my equipment is always in one facility or another.
Okay.
So I don't really need it. And plus, there's plenty of dentists already serving that group of people. That's the main focus of dentistry. So
exactly.
I just feel like I don't need to compete with them. I've, got my own little niche, and I love what I'm doing, and I don't really want to serve the general public.
That's awesome. You can do what you want, and hey, you're the one who went to school for all those years, and you're the man. I mean, that is so neat. What kind of perimeter are you working out of? A couple 100 miles you go, 100 miles? What do you think?
Oh, not near that far. I'm in Rockland County, New York now, and that's another story in and of itself. But anyhow, where I'm at, the county that I'm in probably has 300,000 or 400,000 people. So there's
kidding.
plenty. Yeah, there's plenty of people. I mean, 25 minutes is as far as I have to drive.
Oh, beautiful, man. So how hard is it to get into these facilities? I mean, are they all, you got to get past the sergeant of arms or to the front desk?
It's not tough.
It's not that tough.
No. And like any business, once you learn, what to say, what not to say, how to say it, you just repeat the process once you figure it out. So, for example, when I walk into a facility that I've never been into before, if I want to get another facility that I'm going to serve, I do a little research out in the parking lot, figure out who the administrator is that I need to talk to. I walk into the building, and there's usually some nice lady behind the desk whose job is to prevent me from talking to the administrator.
Exactly.
And I usually just walk right up to him and say something like, "Hi, I'm hoping you can help me. I have a mobile dental practice. My name is Rich Bailey, and I was hoping to talk to your administrator, Diane, about the possibility of, helping some of your residents who have mobility challenges." And that's usually all it takes for me to get a meeting.
Beautiful.
And then, once I have a meeting with the administrator, and usually they make themselves available once they find out what I'm offering. It's just basically show and tell. I've got some good color photographs that show the equipment and show how much space we need, and just explain what kind of care. And I tell them we're not here trying to do major dentistry. We're trying to keep people happy, and that means that means short-term solutions. That means checkups and cleanings, denture adjustments, things like that, and that totally fits in line with what they're trying to do. They can't fix every problem, but they're trying to keep them happy.
What about, is it kind of a Medicaid type thing for them on payment, or is it fee for service? How does that work?
Yeah, both.
Okay.
In order to serve this group of people, you really need to be a Medicaid provider, because some of the people that you're going to care for are on Medicaid.
Exactly.
And some dentists would think, well, that's a deal breaker, but you got to remember, when you don't have to get people numb,
yep,
you can excavate a lot of caries and pack in a lot of fillings really quick. It almost doesn't matter, what the pay rate is, because you can do fillings so fast, after a while. So anyhow, the Medicaid is part of it, and then the other ones are private pay. And, everybody's kind of at a different stage as far as, what they can tolerate and what they want. And although, mostly it's class 5 fillings and denture adjustments. Just last week I cemented a couple 3-unit bridges. So it does,
re-cemented them? Like re-cemented what they had? Yeah. You got a little sandblaster at all? Like a little Danville, on the side?
No. We fabricated 2 3-unit bridges, two different, two different ladies. So you still end up once in a while doing conventional crown and bridge.
Yeah.
But it just comes down to the stage that they're at and what they can tolerate. I kind of use the cleaning appointment to judge what they're going to tolerate from a restorative standpoint, because sometimes you can get away with it and sometimes you can't.
Yeah.
So,
how do you do it when you're cleaning? Are you just using your instruments, or you got like a Cavitron type vibrating situation with the older people? Tell me about that.
Yeah, we got a Cavitron. I found that if you get as aggressive as most dental hygienists do, you're probably going to ruin your chances of getting any restorative dentistry done. And that's what's destroying their teeth, is the class 5 caries. So I do as good a job as what they will tolerate.
Yeah.
So and I use a Cavitron primarily. And I have the assistant running the suction so that we can, knock it off pretty fast. And, we do some periodontal screening record. We check pocket depths, just generally, but we're not trying to keep track of every pocket, because that's not what's plaguing them.
Yeah,
what's plaguing them is class 5 caries. So we knock off the tartar. Once I can see well enough to know what's going on, I make a phone call to the family. This is the second phone call they've received from me, and tell them what's going on and get the green light to take care of the restorative stuff from the family. And so we try to do everything in one visit if possible. because there's only so much you can ask of a senior.
Yeah, and you know what, dude? It's just amazing. You think about it. Think about the whole business model of it. That you're in one little town there, and there's like 300,000-400,000 people. There's probably 50,000 older, geriatric type patients, but that's probably the way it is across every state in the United States. There's probably such a huge market. I mean, have you ever thought of maybe kind of like, RB dental services or something where it's kind of like Smile Bright or one of these bigger, DSO type things? Have you ever thought of like, replicating it and maybe franchising it?
Yeah.
You're such an entrepreneur,
And I checked into it, but, really at the end of the day, I think all that would accomplish, the main thing that would accomplish is complicating my life. Right now, my life is so good and simple. I call that white man's disease. Just, you got things going great, and then you just got to chase one more goal. So what I've done instead for the dentists that want my help, because it is challenging to know what to buy and how to use the equipment and how to, get the written agreements set up. There's a lot of little things that you have to do in order to make this kind of business work well. So what I've done is I've told other dentists, look, it's not my primary goal, but if you want my help, if you want me to mentor you, I charge a flat fee of $10,000, and basically that's going to allow me to help you
to go into a town of all these old people and hook them up, babe. I think that's a great thing. If I was a dentist and I want to change up, I'd pay that in a heartbeat, dude. That's nothing. Yeah. And I just see it all over here. They got Leisure World and all this stuff around me here, and I don't think there's many mobile dentists doing it. And if you got a good game plan like you do, I just think that's awesome. So we'll put that out, your info for sure, that there's some guys out there that I'm sure would like to look into that. I just think it's a win-win for sure. And
it's also a very low overhead business to start as well. I mean, if you don't own any dental equipment and you're starting from scratch, you could put this together, probably somewhere between $50,000 and $55,000 as far as this equipment goes. Yeah. And that's digital X-rays, the trailer, everything that you would need.
That's so neat. That is just so cool. Yeah. I love that. Now, on one last thing with back to your teeth, dude. So you got out of that, and it's like, are you able to start up, like, say, if you wanted to start another tooth thing, or you have a non-compete? But it's been years, man. I mean, could you ever get back into it like that, or no?
Oh, you mean the Billy Bob stuff?
Yeah, no, but call it something different. And we come up with like 6 new designs, so it's not so much, the hillbilly down there. It's more, the rap star. You got Drake's Grill, and we could do the gold grills, but we'll do them out of non-precious and gold plate them. We could do the stars what do you think, baby? Come on, I'll go on it with you.
I think that's your game, brother. I think that I've been there. I kind of view life as like a buffet table, and once you've had potato salad, how many times are you going to eat potato salad? So there's other things on the buffet table that I want to try, and that itch has been scratched from my standpoint. But if you want to do it, knock yourself out, brother.
Yeah, but see, I don't have all that impression with the way you guys did it, to where you didn't have to do a boil and bite. It was kind of, I forgot how you did it. I think we bit into it and then you cured it, or I'm not sure how it was, but it's pretty genius that it was freaking pretty awesome. But I know a lot of copycats came around, but you never know, man.
You'll get a kick out of this part of the story. So the way we did it for a long time was with a polyvinyl impression material. And, I was a freshman in dental school when I was first trying to figure this out. And, I was having trouble figuring out how to make the impression material stick to the shell, that had the crooked, ugly teeth to it. And, when you're a freshman in dental school, you don't know anything, know less than nothing. And I had never actually seen an impression tray, with the holes in it.
Yeah, exactly.
And I'm asking all my professors, how can you make these two things stick together and it not be a liability, where someone wants to sue me? And, they were talking about adhesives that you'd paint on, and, I could see some kids swallowing that stuff, and they talk about different products that you could heat up, and that sounded like a bunch of trouble. And I had I had my Uncle Stan, who's a farmer. He's a hog farmer in the Midwest. And I was explaining the problem to him, and he just looked at it, and he's got this big sausage fingers, and he said, "Man, you're an idiot. Just put 3 holes back here, and then the putty will flow through there, and then it'll walk on there.
Hold it with retention. That was it. That's how you did it. I forgot.
It was the eureka moment, And so, anyhow, that's a little story of how
Stan, the man with the sausage fingers, Uncle Stan. That's awesome, dude. God, it's just a great thing, but kind of fads come and go, but I think it was a great thing. But you never know, man. Another 6 different grills, out there at a good price point, because I remember.
Sky's the limit if you want to dive into it.
Yeah, I got to sell to somebody where I just want to make like 3% off of each sale or something now. I remember where we always got them with us was in the malls, where the things we used to all go to back in the day, but it was a store called Spencer's. And Spencer's across the United States. Yeah, so we got them in there, and we'd get all the different ones, and we try to reverse engineer those things and make them our own. But I think we got to do it because now they got the snap-on teeth, and I got people that, their teeth are all going every which way, and we can kind of do an over, Denmat did them, and they're kind of ugly, not really, they're kind of monolithic looking, but what a difference, to click them on in there, and you got them for pictures and stuff like that. So it really helped, and but that's just something. Those are I think we charge I do a lot of those. For
it's
friends,
fun stuff.
Yeah, for sure. But we charge like $39 a tooth, and it'll cost you, couple $100 for sure, not $20. So price point is where you guys really hit it. But Dr. Bailey, great talking to you, man. Just what a great story, and really, God bless you and your family, and for what you're doing and on this for the people out there, the older people, and for doing what your heart tells you to do. And it's just something. A lot of guys get it burnout in dentistry, and they just get completely out of it, and some will just let it beat them down, and you didn't. And I think the success you had in other avenues allowed you to do what you're doing, where some guys can't do that. But what you're doing too is not a real big startup, and it's every town's got these people, and it's like, come on, you can really, yeah. So
yeah, I think for a dentist who wants to do it, you gotta, although the flexibility and the money part is excellent, you still at the end of the day gotta love hanging out with seniors.
Yeah,
you gotta love. You gotta love the quirky weirdness of it.
Yep. And
you have to, if you're not enjoying that part of it, then any job's going to be a drag if you don't enjoy the actual interaction part of it.
Yeah.
So
I hear you, man. I hear you for sure. There's some dentists that they don't like seeing the regular patients the daytime. They're not going to go seeing the older ones, but I think the older ones, like you said, they're quirky, a little different. Some will have wisdom, some won't. Some won't remember you when you leave the room and come back, but I just think it's got to be something that just really makes you feel good. At the end of the day, you're helping these people, and a lot of these people, the vanity's left and all that. It's not about that anymore at all. It's just about living your best life and having it to where you can keep the grill and things in order. And like you said, even too, like dogs, they adapt. I have a dog that's almost blind and deaf, and they adapt, man. Like nothing's wrong, and it's just you get and pulls on your heartstrings, and you worry, but they're not worried. They're adapting, and they're living a full life for sure. And the same thing with the humans. And as we get older, we're all getting older, and some of us sooner than others. But I think what you're doing is a great thing, Dr. Bailey. Again, man, thanks,
Shaun.
Thanks for telling us about this story of yours, and thanks for coming on the Dental Up podcast. And dude, if there's anything I can ever do, you need any of those bridges, I'll donate some stuff for sure for you. If you ever need some stuff, man, I'd love to help you. It'd be an honor and a pleasure for me to do that. But again, Dr. Bailey, thanks for coming on the Dental Up podcast, and we'll talk to you real soon.
Okay, thanks, Shaun.
All right,
Take
buddy.
Care.
Thanks again.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.